Hi there, my name is Jose Rivera. I am a senior here in the pre-medical program at ATA. I'm going to take you through our classroom and different things that we've done throughout these past 2 years. And if you notice, some of my classmates are dressed up. We are having our hostess-sponsored Spirit Week, so we're a little more festive this time around. And if you'll follow me, I'm going to pass you over to my classmate, Isabella Mellon.
Hi you guys, I'm Isabella Mellon. I'm a senior here at ATA in the pre-med program, and I'm going to show you guys a little bit about what we do. So in your junior year, one of the first things you're going to learn about is a chain of infection and how infections can be transferred and how you can prevent from getting sick in the first place. And over here I have Kylie, and she is checking Ben's blood pressure. So that's just one of the many vital signs we learn, along with temperature, pulse, and respiration. And there are 2 more skills that you learn in your first semester, which are really important, which is fire safety, so you know what to do in case of emergency, and ergonomics, so you know how to properly move without injuring yourself or others. And I'm going to take you over here and show you me go. Show you.
How are you doing? My name is Miguel Hernandez, and during our junior year, we learned about medical terminology. This is a very intense class where we learn root words and complete medical terms. This helps us further understand one another in healthcare. Now we'll pass you on back to Jose Rivera.
Hi there again. So a lot of times in the medical field you want to be more proactive with your thinking, but in situations that you have to be reactive, we have learned CPR, which my classmates down here, Gia and Inez, are going to be demonstrating for you guys. And in case of a broken arm, broken leg, you want to immobilize it, and I have my classmates Kylie, Dean, and Isabella over here demonstrating how to splint. And in doing first aid and CPR, you get certified in both of these subjects, as well as our OSHA certification. It's a 10-hour course that we split apart 2 weeks, and we just learn how to properly be safe in the workplace and what our employers should be doing to protect us, the employees. And I will be passing you off over to Gia, and she's going to be talking about our digital portfolios.
During your senior year, you're going to complete a digital portfolio which showcases all of the examinations and skills that you learn in your 2 years at ATA. A lot of students use their digital portfolios when applying for jobs. They connect it to their resume, and it's also really good for scholarships and research opportunities. Another big project that we participate in is during our musculoskeletal system unit, which my friend Bryson will be telling you more about.
Hi guys, I'm Bryson. So during our musculoskeletal unit, we do our anatomy and clay models. So basically they help us visualize the different motions that muscles make, as well as like just all of the different muscles themselves. As you can see, we've got just all of them that we could name. And then we also have some of the lymph system, and on this one you can see the brain. And yeah, this helps us just visualize the pull of the muscles, and as we go through it, we just we go really in depth with it. Sorry, I can't speak today. And then right over here we have another one of our big projects. This is actually my favorite. It is our sutures. So one of the first things that we do is learn how to actually do the sutures. So you start off with your suture needle. You take your forceps, pinch together the wound, insert, pull it all the way through, leave a little bit, grab the end with the forceps, wrap around 3 times, turn, and pull right on through. Sometimes you have to work it because it doesn't like to. And then you take it and go back the other way 3 times so that you can lock in the knot, pull it all the way through, and boom, you have one suture. And now I'm going to take you over to my good friend Kylie, who's going to show you how to do injections.
Hi, so I'm Kylie. In Health Science 3, we learned how to do two different injections, the intramuscular injection and then the subcutaneous injection. What I'm going to be showing is the intramuscular injection. So first, you always want to be safe with your needle and never take the cap off until you're ready to drop the liquid. And then you draw it back to the number that you started with. Flip the top to make sure there's no bubbles. Push out any if there is. Pull up the muscle. Stick the needle straight down. Let go. And inject. Pull the needle back out. And then always recap so no one gets stuck with the needle. And that's how you do intramuscular injection. And then I'll bring you over here where we will be learning about how to do prong. And my classmate Ben will show you how to do that on me.
Hello, I'm Ben, and I'm going to show you how to do passive range of motion. You normally do this to a geriatric patient or a patient when they're getting a physical to see how mobile is. Right here, I'm going to check Kylie's shoulder. Okay. Would you mind leaning back? Sure. Now I'm going to check her hip. Does that feel okay? Alright, you can sit up. Now I'm going to take you over to my other classmate that resembles me, Matt.
What's up, man?
Today I want to tell you about one of the neurological examinations that we do. We do many, but I'm going to perform the Romberg's test on Gianna, which tests your balance. Gianna, can I ask you to reach your ankle to your foot? And close your eyes, please. Okay, you're good. You look pretty balanced to me.
Thank you.
Good job.
And now Ben here is going to become the patient while Miguel tests his deep tendon reflexes.
How are y'all doing again? Not only did we learn deep tendon reflex in the leg, but we also learned it in the arm. Now I'm going to pass you back to Gianna.
So now I'm going to hook Miguel up to our EKG, which is something that we learn in our cardiovascular unit. And it can be a little difficult at first, but once you get the hang of it, it's actually really fun. Okay. And you can see now, it appears on the screen over here, his heart rate. There we go. So now you can see his heart rate and all of his waves of his heart. And now, another thing we learned in the cardiovascular unit is auscultations of the lungs and the heart.
So hi you guys, I'm going to be showing you how to do the lung auscultation, and it is one of the most important skills that we learn here at ATA. And yeah, let's get started. So breathe in for me. Breathe out. In. And out. So her lungs sound pretty good. This is a really important test. It helps you know if somebody is sick, if their lungs could be filled with fluid, mucus, but she sounds pretty good. So, and this is what happens when you wear antlers to school. Yeah, we're good. We're good. Okay, so now I'll pass you off to Gianna, and she's gonna walk you through some stuff.
All right, well, I hope that was a pretty good explanation of most of the things we do here in pre-med at ATA. All of this prepares us for an internship that we do at the end of our senior year. So we hope to see you soon.
Hi everyone, I'm Dr. Teresa Nierenstein. My students call me either Dr. T or Dr. Teresa.
I am the Health Science Pre-Medical Careers teacher. We also have another teacher, Mrs. McCluskey, that is joining us too in Health Science Pre-Medical Careers. You can contact myself or Mrs. McCluskey by either calling the school and leaving a message with the main switchboard operator, or you can contact us directly by emailing us. Thanks. Hope to see y'all next year.